Hi, my name's Joanne. I'm here today because I want to tell you about the treatment that I've been receiving from Dr. Bob. I'm a 57-year-old woman. In the past year, my skin has gotten very tired looking and it started to droop, and I have some, I guess you would call them tread marks on my face that I wanted to see go away. I just wanted a more refreshed look. Other treatments that I investigated seemed like they were a little drastic, so I was very anxious to come in and have a consultation with Dr. Bob and Darlene about this ablative treatment that they have available in their office. It seemed to make more sense because it does regenerate the collagen deep in your skin layers as it tightens the top layer of your skin. So it was something that wasn't drastic, and it sounded like it was going to get good results. So they gave me a very good consultation my first time into the office. They appropriately answered all of my questions, and they made me feel very comfortable about coming back for the treatment on my face. So I made an appointment and I came back. Upon my first treatment, I was amazed by the results. My forehead tightened up immediately and it got a very youthful glow and shine back to it. I saw some results in this part of my face in the first treatment, but not as much as I saw in my forehead, although I did notice that an age spot that I had after my first ablative treatment on my forehead was gone in one treatment, and the other age spots that I had on each cheek had started to fade. So I set a second appointment with Dr. Bob to come back for a second ablative treatment. The second treatment, oh my goodness, the results from the second treatment. Now my skin is very youthful looking through here. I'm seeing my pores tighten up, my skin is tightened up, and I'm starting to get that youthful glow on this part of my face as well. I also noticed after my second ablative treatment that the age spots the age spot on my left cheek is almost gone, and the one on the right cheek is fading. And again, I'm noticing my skin tightening again. So this is month number 3. I'm back for my third treatment, and I can't wait to see the results after my third treatment. Dr. Bob and Darlene and the ablative treatment are the best. It's very non-invasive, but yet it gives you a very youthful glow, and it makes me look like I'm awake again and not so tired all of the time.
Hi, I'm Dr. bharatwal, Medical Director of Vitale MD Medical Aesthetics and Dr. bharatwal Aesthetics. We're here today with the lovely Joanne. Joanne, welcome back.
You're making me lovelier, Dr. Bob. Thank you.
We hope so. We hope so. Joanne is a patient of ours for several months now. She's on her third treatment of this ablative technology. And since your last treatment, how did you like the effects?
Oh, geez. I came in here looking so tired, and the first treatment I saw results, but the last time, I'm seeing the skin tightening, the pores closing up, the glow coming back. I'm so ready for my third treatment today.
Well, and actually what Joanne's alluding to is the technology behind this ablative technology. Yeah. That's a great and wonderful new technology we have through the Syneron ELOS laser. The ablative technology is a fractionated bipolar radiofrequency that is able to heat up the deep dermal tissue, causing localized tissue injury without causing epidermal or the surface of your skin damage. And what that means to people like Joanne and our other patients is that they get a better response than traditional CO2 or Fraxel by getting a deeper stimulation of the collagen. Now, how does it do that? Well, as I mentioned, by fractionated bipolar radiofrequency. And it uses the radiofrequency waves through this fancy little device here, which is a 64-pin matrix. And so we use this device and we give every patient their own, so it is sterile and used for them and for them only. And each head has about 200 pulses. So this head can sometimes last up to the entire course of 3 to 5 treatments. With this head, it causes 64 little points of injury to the skin. That causes new skin to be regrown and the collagen to be stimulated. Around the tissues that is not affected, we get a localized heating and acceleration of the healing process. So what does that mean in general? Well, in general, that means that we get tighter skin, reduction of the pores, evening out and smoothing of a patient's skin, and reduction of fine lines and wrinkles. So we get an overall tightening and rejuvenating effect from the ablative treatment. And why ablative treatment is better than other alternatives out there is that it's because it is radiofrequency. It can be used for all skin types and skin colors. So we're going to go ahead today and get started. Are you ready, Joanne?
Yeah, I'm anxious. I'm really very anxious.
As you know that we use radiofrequency, so we have to make sure we protect the patient's eyes. So I'm going to ask you, Joanne, to go ahead and put the protective eyewear on. Wonderful. And now this time we're using purely radio frequency. We're not using IPL or pulse light. It's just a pure fractionated radio frequency that we're going to heat up the deep dermal layers while preserving and causing very little to mild epidermal tissue damage. And that way we're going to get a better effect than traditional CO2 Fraxel in terms of tightening, brightening, and smoothing out Joanne's skin. So let's get started. So here we go. We just place the applicator right on the skin. And Joanne, here we go. You feel a slight little tinge. How does that feel?
Fine.
So you can see the patient tolerates. And there you go. The patient tolerates the treatment very well. And you see a little mild erythema and the shape of the checkerboard or the matrix pattern, the 64 pulses, 64 pins, I should say. And so we're going to continue down the face. How do you feel so far?
Fine.
Great. So let's continue down the face. And one section at a time. Sometimes, if there are natural oils, we'll try to wipe them away and move over to an adjacent area of skin. I know Joanne has some troublesome areas here that we're trying to focus on today. So give it a little extra attention with this ablative. And as you can see, between one side and the other side, we can see that there's the erythema and a slight checkerboard pattern from our applicator head, the matrix head. For this ablative treatment on this side, and if you compare to this side, you can already see a significant difference in the skin texture, the fullness, and of course the erythema. So let's continue. As always, we do recommend a course of 3 to 5 treatments for the patients, spaced out every 4 to 6 weeks. And then thereafter, maintenance every 5 to 6 months, 1 treatment, just to maintain this wonderful effect. As you can see, the redness, the checkerboard pattern of the matrix head, and the immediate erythema you see. Altogether, a great effect in tightening her skin, reducing the pore size, helping even out some of the discoloration, reduce the fine lines around her lips and on her cheeks. And we've completed the ablative treatment, and we've got some great results. The checkerboard pattern that we traditionally see, the erythema, the tightening is already beginning in Joanne's skin. But before we discharge the patient, we always like to apply sunscreen to make sure that we protect the skin. We always ask the patients to refrain from any kind of physical activity that requires direct exposure to the sun. Staying away from the gym today, not going into a public pool, just to keep that skin dry, not to use anything medicated in terms of anything with retin A or retinoic acid. We're going to apply a little bit of the Vitale MD Medical Aesthetics sunscreen, which is the photo aging sunscreen with SPF 45 there. And it's a very mild layer, just to keep her covered, because we are in California and in the middle of summer, so we definitely want to protect her skin, and we encourage her to use sunscreen while her skin is red and daily as her daily skin regimen. How does that feel?
Oh, it feels fine, thank you.
Okay. And then we ask the patients to refrain from using hydrocortisone, but they can use a cold pack, just gently placed on their face wherever the affected areas are. But this redness and erythema will go away within a few days. Some patients will see long-lasting effects weeks after the treatment. And again, we always encourage patients to follow up with us, and we follow up with them within a week of their treatment to make sure that the healing process is going well. And if they have any questions, they're always welcome to come back and see us at any time.